Welcome to On Call with Southern New Hampshire Health. I'm your host, Keith Baldy. On Call delivers the latest healthcare news and updates, along with insights into the latest medical innovations and technologies. Southern New Hampshire Health is a nonprofit system serving the communities in Greater Nashua, New Hampshire, and Northern Massachusetts. The health system includes a 188-bed hospital, one of Southern New Hampshire's most comprehensive teams of primary and specialty care providers, and 5 walk-in immediate care locations open 7 days a week for urgent needs. Southern New Hampshire Health, expert care close to home. Thanks for joining us for today's episode of On Call. We're talking about detecting depression and anxiety in loved ones. This is certainly a topic that has become important as society recognizes the significance of behavioral health. Joining us today to talk about this is Dr. Ciara Kazakis, a primary care internal medicine provider at Southern New Hampshire Health Downtown Medical Associates. Dr. Kazakis, thanks for joining us.
Thank you so much for having me, Keith. I'm excited to be here.
So we always like to start out a little bit, just getting to know the doctors on our program. Tell me a little bit about yourself and why you decided to become a doctor.
Yeah, for sure. Again, thanks for having me today. Initially, I went into medicine. It was between becoming a veterinarian and a human doctor. I love animals. I still am a huge empath for animals. As I started getting older, my mom unfortunately got sick. She dealt with some mental health issues.
Sorry.
My grandfather was diagnosed with prostate cancer, and I was really able to see how the providers and the doctors that they worked with were able to help them through those tough times. And not just with medicine and, their recommendations, but by their empathy, with their compassion towards both my grandfather and my mom with her struggles. And that really kind of clenched it for me that I wanted to be hopefully that person in someone's life to be able to make a difference like that long term. So that was really kind of the turning point for me to pursue a career in medicine.
Well, I'm sorry to hear that, but those experiences shape us all in some ways, and so we're thankful to have you as a doctor. However, it came to be
here. Yeah.
So we're talking today about mental health. As patients, my age especially, we didn't used to think of mental health as something that you would bring up to your primary care provider. That's changed, right?
It has, and we're very thankful it has changed. And it's funny that you talk about that because I was listening to another podcast, professionals talking about mental health, and, it was back in the day, everyone, on the street that you lived on, everyone had the perfect marriage, right? Everyone had, the perfect children, and everyone was happy, there wasn't stress, and certainly didn't talk about it, right?
Right.
And so it has really come a full 180. Mental health has been recognized as something that affects most people. I think at some point in time, everyone deals with anxiety or depression, and it is now a very accepted medical diagnosis as much as COPD or lung disease or cancer is. And we recognize now that it's not just something you can will away. It's not something you just say, well, pull your bootstraps up and carry on. It is significant. It's impactful. It can harm families. It can end lives. And it's something that is now really, like I said, full circle. And we're very grateful for that because a lot of people have struggled for many, many years because they were shamed into not getting the help. They felt embarrassed. And that stigma has really been lifted. And now people are getting help and they are thriving in their life and they are making meaningful connections and relationships and building a support network. And that's been very, very helpful for the mental health community.
Yeah, dispelling that taboo is so important, right?
Yes.
I mean, if you can't talk about it, especially because it's not like a, quote unquote physical ailment where people can see.
Right.
You're not feeling well, you don't look well, you have a broken leg, whatever it may be, right? I mean, that's just
it's not an objective thing for a lot of people. And for, like you said, a lot of time it was kind of shrouded and it was, looked down on to have a mental illness. But again, there's been a lot of research, culture has changed, and we now recognize it as, a significant, disease, significant ailment that affects people and they can get help for it.
Right. And you look at the numbers, I was just listening to something today that talked about the number of people who called 988, which is the
Yeah, the suicide crisis,
and
yeah.
crisis helpline.
It's a great resource.
It is a great resource,
Yeah.
and it just shows by the numbers that people are seeking it out and it's helping people.
Yes,
So,
exactly.
so what are some of the signs of depression or anxiety? Early subtle indications that sometimes people might overlook.
Yeah. So, like I said, I truly believe everyone, deals with elements of depression and anxiety, but it can look different for different folks, different populations, different genders. So I think it's important to be able to recognize the characteristics. Some of the first signs of mental health challenge could be just irritability. People are just, they're more likely to have negative interactions with things that maybe they wouldn't have had in the past if they weren't struggling with an element of anxiety or sadness. So irritability, even with loved ones, really is something, and even clinically is something I see as well. So just being a little bit more negative, things that, someone cut you off in traffic that maybe, if you were in a better headspace, you'd be able to handle more, but you kind of fly off the handlebars, or your child spills milk, and suddenly like that is very overwhelming for you. And maybe you react in a way that you feel bad about later, So irritability, I would say, is the biggest thing. What we oftentimes see too is struggle sleeping, fatigue, because again, it's hard to prepare your mind for sleep, quiet your mind to get restoration when you're ruminating about things that are concerning to you. You're ruminating, and it's just hard to kind of quiet your brain. So even if you do get to sleep, sometimes you don't stay asleep. So irritability, fatigue. Sometimes people even go to bed at 9 o'clock and get a full 8 hours of sleep, and then they wake up in the morning, they still don't feel rested. They're tossing, they're turning. And we know that to be a sign as well. So sleep patterns, sleep habits, restlessness as well. Concentration is also a big kind of harbinger for mental health. Concentration goes down, inability to focus. We see that a lot. I would say men kind of present with that too. Inability to focus at work, having a challenging time concentrating. And from that will stem feelings of irritability and anger. So it can even be poor performance at work, when work starts to slip. And then, of course, we do kind of have the other classical things, just feelings, of lowness. You're not finding pleasure in things you used to derive enjoyment from. Those are kind of all the classical things that people think of for depression or anxiety. But there are also, like I said, subtle things in the irritability, more fatigue, insomnia kind of come to mind.
Those are great because, like you said, they're subtle and you may not realize what's going on.
Right.
Of course.
Yeah.
Attributed to something else.
Right.
Now, these symptoms can differ from person to person, right? I mean, across different age groups.
Yes.
Male to female. What are some of the things that, might be a little different?
So what I notice is sometimes it can be a gender thing too. So men sometimes, especially with depression, we see them slip into coping mechanisms for their mental health that they think are easier to kind of conceal. They don't want to make their significant other or their partner upset or their family upset. So they might, start using alcohol a little bit more frequently. As really unhealthy coping mechanisms, kind of come about in what I've seen and what the studies have shown for men. So sometimes depression can come about in men drinking a little bit more, and it's not just they're maybe struggling with addiction or alcohol use disorder. It's they're covering up a symptom from something deeper. So that's something to be mindful of, especially in the male population. Sometimes men also will turn to what they call escapist behavior. So that's really kind of trying to dive into their work or, dive into a project and, just to kind of escape their whatever's driving that mental health, those negative mental health feelings, whether it's home life or, a marital issue or a child issue. And they really kind of, again, escapist behavior. They don't They don't know how to deal with what's making them hurt, so they dive into what they know. They dive into what's familiar. That's their work, that's their computer time. So spending a lot of extra time at work, really kind of grinding it out. Those are all kind of concerning red flags, and again, more for the male population. Not that women cannot demonstrate these behaviors, but men sometimes present, a little bit differently. What's also really important to understand too, and why I really try to encourage men and to come and talk to their doctor, is because although women, statistically speaking, are more likely to attempt or talk about suicide, men are, statistically speaking, more likely to complete it. So that, and that's concerning,
Right.
So I really, for everyone, but I really try to encourage men. I really try to encourage them to come talk to your doctor. These are not feelings you should be ashamed of. Whatever's happened is in the past. There's always a way forward, but just having that courage can be hard. But to understand that your doctor's aware. None of us in healthcare, primary care specialists, have the notion that men don't suffer from mental health.
Right.
We know. We know. So, and we're not surprised. So I would say men can present, a little differently.
Well, and also, like you said, we were talking about stigma before.
Yes.
It's a little different for men. There's still that idea of, like you said, you grind it out at work. You do,
Right.
You can get through it no matter what. You don't need help.
Right.
But that still exists in our society.
It does to an extent. They're the pillar of the house. They're the column. They can't have a shaky foundation.
Right.
And that's just not realistic thinking anymore. We know that the world is very confusing. It's very chaotic right now. Relationships can be challenging for men and females. So mental health can and does affect men. Unfortunately, men are just later to presentation.
Okay.
Women are very good about knowing that they're not feeling well. They're less of a stigma kind of attached with them getting mental health help from their perspective, not
Sure.
from ours. So for women, we do kind of see weight changes sometimes will happen. Sometimes women will find, comfort in food, or maybe not eating as much. So weight changes, can come about, especially in our female population. Again, the irritability, the restlessness, feelings of being overwhelmed, kind of flying off the handlebars at that, kid that spilt milk on the kitchen table. Those are some of the things. And again, this is not a box. These things can kind of bleed into each other. But if you're asking for what I've seen, kind of, what the research has, supported, what surveys have supported, those are some of the characteristics that we see with mental health, which again can differ, between genders.
And you touched on this, but I think there's a fine line sometimes in people's minds when we're talking about loved ones who are looking out for people in their family, of what might just be, okay, so-and-so is off today. They're a little irritable. Maybe they had a bad day at work.
Sure.
Maybe they had a bad day at school, and then taking it to the level of concern, right?
Yes.
And how
Yes.
I guess that's tough sometimes.
Yes. And it can be challenging and it can be daunting to approach a loved one, because especially if they're not in the territory to accept a conversation like that. So I do think being mindful about how you approach a loved one and making sure that you use a lot of open-ended questions, trying to stay away from anything that could be punitive, or derogative, like, oh, hey, I noticed you're not sleeping. That's really bad for your health. You didn't wake up this morning and put gas in my car. Trying to make sure that you're staying away from, blame shifting and creating a space that say, you seem a little bit more tired lately. Is there anything I can do for you? Leaving open-ended questions, making sure that when you approach, what I like to do is I always like to approach it with a question that puts folks less on the defensive. So is there something that I'm doing that's maybe causing you to not get more sleep? And, they think, oh, well, I'm not ready to talk about this yet, so she's giving me an out. I can say, well, now that I'm thinking about it, you keep your phone on it. Now, they have an out. Or, well, it doesn't really sound like this is a negative connotation. So maybe I will discuss, well, it's not really anything you're doing, but I have noticed that when I go to sleep at night, I can't really shut my brain off. And that's all you need. You just need a little tiny bit of an entryway for them to feel comfortable discussing and exploring. It might not happen on the first conversation. It might be the 30th conversation, but having those regular check-ins, and what I always tell people too, and this is powerful, and this was a psychologist that I was listening to, and he said, when you're concerned about someone and they're going through a challenging, time in their life, the environment for them is challenging. They're dealing with something. Instead of telling them, if you need anything, you come to me. Don't leave it up to them. Say, I'm going to come back and I'm going to come back and talk to you. I'm going to come back in a week or so. I'm going to come back and just see how you're doing. And that makes them feel like you're taking a step for them instead of leaving it in their court. Because a lot of times people with mental health, they don't want to be a burden. They don't want people, their loved ones, to have to, to have to figure out their problems. And again, even if that's not real, that's their perspective. So to have that off their chest, like, oh, well, she's going to come and talk to me. It's also kind of, all right, well, it's a little hopeful.
Reassuring.
It's reassuring that they're going to come back, they're going to check. They're not leaving it in my court to do. That's not another thing I have to do, right? So.
Right, especially when it becomes like you're saying, overwhelm, or, I mean, depression obviously has a part to it that, you can see if someone is lacking motivation.
Right.
Right. I mean,
right. Exactly.
You may sleep longer, as you said, or whatever. You don't feel rested. Yep. So if the onus is on you,
right,
you may not simply do it.
Exactly.
When this is great because you're describing these conversations that are pretty universal to a lot of people, right? I mean, especially between spouses, parents and their children.
Exactly.
Especially when they get older, right? The support networks that we have, we need to rely on.
Right.
So when do you think someone should encourage their loved one to get, professional help, to see, their doctor, to see, maybe a psychologist,
therapist.
A social work therapist?
Yeah, well, that's a great question. Everyone has a bad day. And you had mentioned this before, and that's fine. Everyone's allowed a bad day, and we need to meet people where they're at. What I say is when it's starting to affect their activities during the day, when it's starting to affect relationships, whether it's a relationship with their coworkers, relationship with their boss, relationship with their partner, with their children, in a negative way, that's when you really should, kind of move forward with the process. Because again, everyone has a bad day. Everyone snaps at people every once in a while, and we're humans. We're allowed to do that. It's nice when you can go back and say, hey, Keith, I'm sorry I had a bad morning this morning. May came off a little sharp. I hope you forgive me. I'll be more mindful in the future. But it's when it becomes a pattern. It's like every week or every couple of days she's coming into work, and she seems very irritable. I had asked her if she could just sign this paper. She kind of snapped at me a little bit, and it's becoming more of a pattern. I'm kind of starting to not really like the way I feel when I talk to her, when I approach her. I think at that point is when an intervention needs to, and I say intervention, it's not something crazy, but, I think a change needs to happen. So to kind of, long story short, when it starts negatively affecting relationships, I think that's when steps need to be made. Certainly, and this usually comes later, certainly when your health is affected as well. So we kind of talked about the unhealthy coping mechanisms. So certainly, whether it's tobacco or alcohol use, if those things start to show health concerns, you're at a real cross point by that point. Usually at that stage, relationships have already been affected, usually negatively. So I would say the first thing to really kind of notice is, how are people feeling after they interact with this person? Especially when they don't seem like they're in a good state of mind. How is their son interpreting their behavior? How is their partner interpreting their behavior? And how do you feel? Do you feel good after you talk to this person, or do you kind of feel down? Like, do you feel slighted? Do you feel angry after you talk to this person? And that should definitely start setting off bells that maybe we need to consider, a conversation.
It's important to build relationships ahead of
Yes.
time with people. And that's when you get close, like we're
Yes.
talking about our families,
Yes.
that we should be able to notice.
Yeah.
Yeah. It's so important. So, if someone has that significant anxiety or depression in that moment, what are a few helpful things that a loved one can do? I mean, we kind of talked about this, but get that encouragement,
Yeah.
that to move forward, to maybe to reach out to someone.
Yes. And what I would have to say too, and this is something I even struggle with folks in my family, it's important, and it's hard, it's important not to react. It's important not to react. And they may snap at you, they may do things that, gosh darn it, make you angry, but don't react. If you have to say nothing at all, bite your tongue. Don't say nothing. It's better to pause, even if it's an awkward pause. Take a breath and say, I'm not really sure I'm ready to respond to you right now. That's fine. That's perfectly acceptable. So, but also understanding that it's really nothing personally directed against you. You are just, unfortunately, the body form in front of them at that particular time that they're having that challenge. It could be anyone. It could be Britney Spears in front of them, and they'd react the same way. So, and again, it's hard because as humans, we want to take things personally. But when you're dealing with a loved one who is struggling, who's really kind of going through negative emotions, having these repeated bad days, to understand that it's not you, right? You're not the one that's causing this. They're not trying to direct their anger out at you. You just happen to be there. So don't react, and just kind of take a deep breath and say, again, I'm not really sure I'm ready to respond to you right now. I'm going to take a couple minutes, maybe go walk outside for a moment, and then come back.
People close to us, it's always hardest.
Yes, it is.
And I didn't have a Britney Spears on my bingo card today to pop up in this, so I'm very happy that we were able to throw that out there. So
Britney has struggled as well.
Hey, no, exactly.
She has struggled.
So we spent most of our time today talking about how to spot the signs in others, right? And in doing that, we're talking about how to spot the signs in yourself, I suppose, too.
Right.
But
yeah.
This is something, if someone's listening, these signs, you can get help yourself, right? I mean,
Yes.
You don't just need to be looking out for your partner, your child, your neighbor, or whatever.
Yeah,
you need to look out for yourself too.
No, definitely. And, and I think it is hard. It is challenging. And like I said, I've dealt with my own bouts of anxiety and depression throughout my life. And it can be challenging to accept help, but the people that are closest to you and love you want you to do well. Your doctor wants you to do well. Every physician you interact with wants their patients to feel good. It's the best thing in the world when I see a patient who is struggling, they come back a few months later, they're involved in therapy, they're getting the help they need, and they feel good. It just makes my day. So if you're experiencing any of these things, you're thinking, geez, well, I've kind of been working a lot because I'm going home and my husband's driving me crazy, or, the house is a mess, or I can't deal with everything that needs to get done at home. And I have been spending a lot of time at work. I don't need to, but right. I have because, darn, it's hard to go home, right? It really kind of weighs on me. Recognize those symptoms and understand that those symptoms are normal, right? This is normal. It's just there are a lot of resources out there that can help you obtain a toolbox, if you will, of utensils that you can use to help you manage that. And it's not just medication. People think, well, I'm going to get them. It's not just that. There's a lot of things that cognitive-based therapy, working with a therapist or a psychologist can just help you with, and just sometimes it's just changing your perspective a little bit, but like you said, if any of this that we've talked about today has spoken to you and you are starting to recognize a pattern, get it early and get it now, because what's so disappointing for us as health professionals is when people are kind of at the end of the line. Right. They've been dealing with these feelings for years and years. They've been too afraid or shamed to get help. And it's very hard. It can be done, but it's much harder to do that work when you're on, the 10th step versus when you do start to, realize I'm not really feeling that great over the past few months. Maybe I need to talk to my doctor. maybe they can get me plugged in with a good therapist. Therapy has come a long way as well. There's telehealth options now. I have plenty of patients that hop on a telehealth in their car, during lunchtime work, and that's been very helpful for them. So it's not just, the classic Freudian
Lay on the couch.
going to a psychiatrist, laying on the couch with, a warm towel across your forehead. It has come a long way. The other thing I want to just encourage people to is if you find a therapist or you find a mental health professional and it doesn't click for you, find another one. We don't take that personally. You have to be able to find someone that you click with. I had a male patient who was seeing a therapist, and he was probably in his 50s and had a family and, career, profession, and they wanted him to, be with a therapist who was in her 20s, a female. So not really much in common, so that was a challenge for him. And I just encouraged him. I said, let them know your preference, and they'll work with you, find someone that fits you. So I just want to make sure people know that that's okay.
Oh, that's great. That's great. All great advice for people. And I think it's really important. And as we mentioned, at the beginning, things have changed so much. And you're there for people, for your patients, all of our doctors, clinicians, they're all there for people. And like you said, we all just want people to live healthy, productive, happy lives, right?
Exactly.
So
life's too short, so you want to find the enjoyment in it.
And screenings help too. I know that, we do screenings in our hospital, in our, in your offices. It's important because sometimes people don't want to just bring it up.
Right, exactly.
But when you have that opportunity to fill out a couple of questions, maybe you do start realizing, like you said,
right,
you're hitting on some of those points that make you realize that something's not exactly how it should be or how you want it to be.
Exactly.
So thank you so much. All right.
Thank you for having me today.
Of course. And as we wrap up, I just want to mention that Southern New Hampshire Health has a great way to make sure you can find the best primary care provider available. You can call 1-603-880-EASY. That's 1-603-880-3279, and you'll be matched with someone who best fits your needs. Dr. Ciara Kazakis, a primary care internal medicine provider at Southern New Hampshire Health, Downtown Medical Associates. Thanks so much for joining us.
Thanks for having me, Keith. I appreciate it.
And we do throw out there, since we talked about it, if anyone is in crisis or, they can call 988 as well.
Yes, please pick up the phone. It's 24/7 hotline. They're wonderful people on the other end, and they will get you through it.
It's great to see you.
Thanks, Keith.
Thanks. Okay, well, thank you so much. As we wrap up, I just want to mention that Southern New Hampshire Health has a great way to make sure that you can find the best primary care provider available. You can call 1-603-880-EASY. That's 1-603-880-3279, and you'll be matched with someone who best fits your needs. You've been listening to On Call from Southern New Hampshire Health. For more information about the health system or to learn more about some of the topics featured in this podcast, visit us on social media and on our website, snhhealth.org.